Today's video is the foot massage. I'm going to be showing you some techniques working on the base of the foot and up and around the ankle joint. A nice way to start off is to try and get the client to relax. So we call this a foot flop. I haven't actually put any lotion on at the moment, but it's trying to get some movement there. My client's ankle feels a little bit stiff this morning. So let's get that going nice and relaxed. And then we're going to work and put some lotion on the foot. So warm it up first. As you can see from the couch setup, I've got a bolster under the knees. The client is covered up with a towel so they feel warm and comfortable through the treatment, and they've also got a pillow there. So I am doing effleurage. Could be called alternate hand effleurage. I'm working up and down. So it's any technique really that you can get to the base of the foot and the top of the foot as well. The warmer we get it, the more pressure we can take. And the foot takes a lot of pressure through the day, whether you're standing or walking around. So we'll increase our pressure slowly to do some quite deep techniques. And today I'm going to be using a tool on the base of the foot as well. Okay, so I can feel it warming up a little bit. Always alternate between different techniques as we're working. So just to get a little bit deeper, I'm going to go with a fist. I'm going to use a fist down the sole, support on the top of the foot. So it can be a closed fist like so, or like an open fist here. And we're working from the distal heads of the metatarsals up here at the top, and we're working right down to the heel bone or the calcaneus. Again, it should feel fairly comfortable, but depending on different foot conditions, which you found out already at the start, with plantar fasciitis it's quite common. It might be a little bit more painful, more tender. So I'm using heel of hand here along the medial arch. My client here has got a nice arch in the foot. You'll see different feet, lots of different foot arch positions and deformities on the feet. We've got a nice arch here. I'm going to have a look at the mobilization between the metatarsals. So what I'm going to do here is hold on to metatarsal 1 and metatarsal 2, and I just traction between the two. So I'm pushing and pulling just to have a little feel of the movement. So you've got lots of tiny little muscles in between these metatarsal bones, and there should be some nice movement here. Okay, so I'm just having a feel first. Between 2 and 3, there's not so much movement, which is understandable because they've got links from both sides. It's really, I wouldn't say aggressively, but get in there and really try and move those bones. So we're going backward and forward, a bit more between 3 and 4. And then between 4 and 5, you can see there's quite a lot of movement there as well. Okay, let's go back to effleurage. What I want to do is get in between the metatarsal bones with either reinforced finger, thumb, or you can even use a massage tool, depending on what's easiest for you and the pressure that you want to give. So I'm going to go with fingers first. So for this one, I'm going to put my fist here. That opens up and kind of spreads the metatarsal bone slightly. So in more supported position, I'm going to reinforce my finger, and I'm going to get in between metatarsal 1 and 2. There's quite a nice gap here. Okay, and it can feel quite tender, this technique. So it's good when clients are supine, you can have a look down the couch, have a look at facial expressions to see if it's uncomfortable or not. Normally they will tell you as you're doing this. So that's between 1 and 2. And then we're going to go between 2 and 3. So we're getting in. There's not so much space between 2 and 3 and the next one. Okay, and then 4 and 5. There's a little bit more movement in that one. We've got a bit more space there. So what you could do is, if you had a little massage tool, you could use the same thing and go between each one. So it's just trying to ease off those really small muscles in the foot. Okay, so let's do a bit of effleurage back over the top. Go back to a foot flop. See how relaxed they are. There was more movement there than there was at the start already. And I'm going to go and have a little feel of the traction. So come back and do the same technique. You can see that movement there, that's going nicely. Okay, and then hold here. Still quite stiff between that one. There we go, that's moving a little bit more. This one, that's more movement, definitely. Okay, and then 4 and 5. So it all feels a lot freer already. And we've only done a few techniques on this part. So you can go for a foot massage, and people don't often go on the top of the foot here. So it's quite nice to have that worked on. So effleurage off again. I'm going to focus more on the base of the foot. We can go back to using our fist again. We call that effleurage du poing. You can go down or up. The direction doesn't really matter on the foot. So we're not doing long draining techniques. Okay, and then we can use thumbs, we can use open knuckles, we can use fingers, we can stand up with any position really. I do find a thumb is quite nice on the base of the foot. So reinforced thumb, working up on that plantar fascia. Okay, and then we can spread out as well at the end. Trying to ease all those muscles or lengthen all the muscles in the foot. Okay, at this point, I might want to use a massage tool. So I do have a rock blade with me. These are really good. They look quite aggressive, but it's how you use them. So with this, I'm going to go up the base of the foot. I'm going to slide slowly. And with this tool, I'm able to feel all the connective tissue underneath, all the fascia, the plantar fascia. I can feel it like bubble wrap. Feels like it's popping. So it does get a different pressure rather than using your thumbs, two soft tissues on each other. You can actually feel a different sensation. So we can work with that a few times. We can use it more like this in smaller areas, or use it as long techniques up the foot. Okay, another thing with the foot is the movement of the big toe. And if people struggle with toe movement, like my client here doesn't really have much flexion in the big toe. Extension is not too bad. Flexion is a little bit limited there. But if you think for running, toeing off at running, the better that angle, then the foot can get a different angle when they are running or walking. So big toe or hallux rigidity is something we could try and mobilize as well in a treatment. Try and encourage that movement. Okay, we could actually apply a little bit of traction in that and take it into flexion. Traction, flexion. So stretching a big toe might sound a little bit weird. So we're used to stretching big muscle groups, but this is where movement starts from. The big toe into the foot, into the ankle joint. Okay, so base of the foot is starting to warm up a bit. I'm going to do a technique, it's called soft tissue release. And this involves shortening the tissue. So if this is the foot, we're shortening the tissue. We put quite a deep pressure in, and then we get the tissue to extend. You'll feel a stretch from where you're pressing up through the rest of the connective tissue. Possibly it has potential for the client to cramp a bit if they do stop straight away and to stretch the foot out. But we're going to get our client to go into a flex position. I'm going to put quite a deep, come around here, deep point in mid-foot, and then get my client to extend or bring their toes back. That's it, as far as they can. And they'll feel the stretch from there upwards. It takes all the pressure off the base of the plantar fascia. Relax. Okay, relax in between. We'll do it again. Flex. Put the pressure in, quite deep pressure. And then extend. As far as they can. They won't want to go too far because it could feel quite tender. I'm looking down the couch. My client is breathing a little bit heavier, and just effleurage over the top. Okay. You can also do foot massage when they are prone on the couch. So when they're lying face down, you can include it as part of a calf massage and be working that way. But it's quite nice, I think, for the therapist to be sat and focus on the foot in this position. And then we can also assess the ankle movement. So we've got inversion and eversion. Okay, it does feel a little bit stiff in this ankle joint, but we can work around the ankle using finger circles. Just work all around there. So if a client has previously had an ankle injury, an ankle sprain, the most common ligament to have injured on the ankle is called the anterior talofibular ligament, the ATFL, which is, if you want to come around and have a look. Okay, so the ligament here, if you have an inversion ankle sprain in that position, that's the ligament just here that you will aggravate or tear, depending on the grade. Okay, so we can work, and you might find the fibers feel a little bit thicker around this area or slightly more tender. We can friction around that area. Any friction technique, please reinforce your fingers. Never do anything with a single digit. Get in there and reinforce it. So we can work all around that ankle joint, trying to encourage the blood flow. And you will see some erythema as well, which is good. Okay, so I'm just linking all that together and effleuraging to finish. So I might have spent about 10 minutes on that foot. Clients coming in for ankle issues or calf issues, I'd always include foot as part of that treatment. So 10 minutes on both feet, 15 minutes on the calf and shins. I'm going to be doing a video on the shin as well. So you could actually easily spend an hour just working on lower leg and feet. How am I going to finish off? Well, let's see how relaxed his foot is. Hopefully if you flick back to when we first started, is there more movement there? Okay, and let's go right up through the toes. Okay, cover the leg back up, and we will finish there.